Chris Martin has been the frontman of Coldplay for over 2 decades, captivating audiences with his voice, energy, and laid-back style. But as the years have passed, some fans have noticed subtle changes in his hairline, raising the question, is this just the natural evolution of his look, or are we seeing the results of a carefully executed hair transplant procedure? In this video, I'll analyze photos across different eras of his career. I'll break down the most likely procedures involved, and I'll explore what it would take to achieve this type of transformation. From graft counts to possible costs, let's take a look. In the year 2000, at the age of 23, we see here some anterior temporal thinning. The overall shape with the anterior temporal point is still there, but it has thinned out a bit. And we're seeing some frontotemporal recession with a Norwood 2 type of appearance. In 2001, at the age of 24, Chris is now moving towards a Norwood 3 configuration. You see those frontotemporal corners becoming more prominent. But he does have strong forelock density and good fullness throughout the remainder of his visible scalp. In 2002, at the age of 25, we see strong crown fullness, and he has great density throughout the classic donor areas. In 2003, at the age of 26, we see here that the frontotemporal areas are starting to open up even more. This occurs as the temples further thin and the lateral hairline recedes more superiorly and medially. The area above his ear is also looking slightly thinner, and the same holds true for his lower temple. And this is something that we often see with retrograde alopecia. This is a subtype of androgenetic alopecia, which is the most common form of hair loss in men. It's essentially the reverse of the top-down type of spread of androgenetic hair loss that we see. With retrograde alopecia, we see that the bottom of the occipital scalp hair starts to thin and it starts to shift up. Also, around the ears gets a bit thinner and the temples as well. And this makes surgical planning for an FUE procedure more complicated because areas that are traditionally considered safe may no longer be if someone experiences retrograde alopecia. Keep in mind that when someone is younger, like in their 20s, you don't exactly know what their horseshoe will look like when they're much older. Will it have some height to it, or will it be quite small and narrow? In 2005, at the age of 28, notice that Chris's frontotemporal corners are well masked with his hairstyle. And this is one of the reasons not to go too low with hairline design when it comes to hair transplant surgery, because oftentimes people are not wearing their hair slicked back, so when you wear your hair naturally, it will look like your hairline is lower than the actual line is. It's better to preserve the grafts and place them into areas that have thinned so that you can get better density rather than driving the hairline too low with surgery. In 2006, at the age of 29, I see no change. In 2007, at the age of 30, Chris was wearing a lot of hats that year. Could that be a sign of possible hair transplant work? Many people wear hats to cover up their hair loss, and also many of my patients wear hats during the recovery phases of hair transplant surgery. But then the hat comes off. In 2008, at the age of 31, compared to 2001, we can see that the frontotemporal areas appear more filled in. To me, the central hairline looks untouched, and this may have resulted from a procedure of about 500 to 700 grafts per side into the frontotemporal corners. If he did get a hair transplant around this time, it was likely an FUT approach, where a small strip is removed from the back of the scalp, and that strip is then microdissected, and those grafts are then implanted into the new location, in this case the frontotemporal area, possibly. Remember that FUE surgery only became more popular around 2015-2016. In 2009, at the age of 32, it's very difficult to tell the exact hairline changes because his hair is being brushed down. In 2010, at the age of 33, these potential hair transplant results are now a bit more obvious in these images. Again, the frontotemporal corners, to my eye, appear more filled in than they did before. His temples, however, appear to be untouched, and that makes it less obvious that any work was done at all. It's always a trade-off when it comes to doing a hair transplant for the temples. On one hand, it helps with the framing of the face. You reduce that lateral width of the face if you bring the temples in. But there are some disadvantages. For one, it might make it a little bit more obvious that a change occurred, so people might recognize that, hey, maybe this person had a hair transplant. Also, it can consume a lot of grafts, and sometimes those grafts are better invested in other areas, like let's say further back on the scalp. Each temple, depending on the size of the area that you're transplanting, can easily consume anywhere between, say, 200 grafts and 500 grafts per side. That's a big investment of grafts. And sometimes there could be a color mismatch because the hair on the back of the scalp, when it's moved into this more temporal region, the temple tends to have hair that turns grayer at a faster rate. So if you now place darker hair there, you might see that color discrepancy between the darker hair that's transplanted and the lighter hair that's naturally there. Now, it's easy to cover that up with dyeing your hair, but not everyone wants to do that. So that's something to consider. So even when the temples are grafted properly with good angulation and proper directionality, which is already not that easy to do, and you have to make sure you're going to the right place that knows what they're doing with the temples. But even if that's done properly, there are some of these potential disadvantages to consider when you're maybe thinking of getting the temples done along with the rest of the hairline. In 2011, at the age of 34, to my eye, it looks like Chris's central hairline was preserved at its original height, and that makes it less obvious that any work was done. In 2012, at the age of 35, I see no change. In 2013, at the age of 36, again leaving that central hairline untouched and working at a slightly lower density here has preserved a fairly natural looking appearance. It doesn't really look like anything obvious was done. And part of it again is that low density that we're seeing here. The contour has changed to the hairline, but the density is still rather weak, and that again doesn't make it too obvious that anything happened. And that could be one of the advantages of transplanting at a lower density. I know oftentimes people look down on low density work, but in reality, sometimes you can get away with it without people noticing that too much happens. So from that perspective, you could see it as a potential pro in some instances. In 2014, at the age of 37, I see no change. And in 2015, at the age of 38, I again see no change. And in 2016, at the age of 39, we see that compared to his image here from 2003, clearly there have been some changes to the frontotemporal areas. But regardless of whether or not he had a hair transplant, Chris has done an amazing job of preserving his existing hair. And to this day, his hair is looking really great. And not just at the hairline, right? But even further back, like the rest of his frontal scalp, mid-scalp, crown is looking very healthy. And he's done a great job of that. And likely it's because of medical therapy. Because you don't necessarily want to leave it to chance, especially if you're investing in potential hair transplant surgery. So staying on medical therapy is very much part of the equation when it comes to hair restoration, especially for long-term success and great results that will stay with you for decades and decades, right? And the main medication when it comes to protecting your hair in guys is finasteride. And there's a stronger version, dutasteride. We have a video out on dutasteride if you want to check that out. But the main place where a lot of people get their finasteride these days is feelconfident.com. It's a great website that I helped start 2 years ago, and it's basically a very affordable way to get this generic medication that is tried and true and has been working for decades for people. So if you want to learn more about it and see if you're a potential candidate for this medication to protect your existing hair, head to feelconfident.com and check it out. In 2017, at the age of 40, we can see here that the surgical density that's created from a single procedure into a more bare area of the forehead, and in this case the frontotemporal region, is usually lacking in density compared to the very dense forelock or the original hair that existed in that location. So while it might not be an exact match, especially with a single procedure, if it's done properly, usually it's close enough where it's very difficult to tell that there's a density drop-off. But again, you can always come back in and layer in more grafts to build up that density more. The most important thing is that the initial surgery is done properly with good control over angulation and directionality, So that coming in to just build that up more is not such a big deal. But if the initial procedure is done in a faulty manner where the angles are way off or the direction is off, then it's much more difficult to build on that, because when I come in for an additional hair transplant, I have to decide which population of hair am I following, the person's original angles and directions or the transplant that they had, let's say elsewhere, if it doesn't follow their original. And that can be a difficult decision to make. So again, wherever you go for your initial procedure, make sure it's a place that actually cares about the artistry of hair transplant surgery so you get the work done properly. It's much more difficult to fix later if some of that initial stuff was not properly considered. And we have a video on how I generally approach hairline design, so make sure to check that one out. In 2019, at the age of 42, we can see that when we look at Chris's image here from 2001, we can notice a clear hairline shape difference. You don't need to be a hair transplant surgeon to see that there's clearly a different quality to the hairline, right? If you follow it from the center all the way out lateral, you can see that there is a shape difference. And this generally does not occur on its own. Perhaps he used some medical therapy, different types of microneedling or laser caps to try to restore and reconfigure that area. But the alternative is, of course, that he may have had surgery. In 2020, at the age of 43, I see no change. In 2021, at the age of 44, Chris now has more density in the frontotemporal areas, even more than before. His hairline also appears straighter to me, and there's more irregularity present. The temples still look untouched. My suspicion is that he may have had another small hair transplant procedure around this time, maybe another 500 to 600 grafts per side of his hairline to further augment density and to slightly change the contour again. If he did get another procedure around this time, the harvesting method was likely an FUE procedure. In 2021, FUE was already the dominant way internationally that people were using to harvest hair, similar to the trends that continue today. Though I must say that sometimes I do re-excise old FUT scars. When people come to me and they say, hey, I had an FUT procedure before, I had a pretty good experience with it, can we just remove the old scar with some additional hair and close it back up into the same scar? Sometimes we can do that. If there isn't too much tension in that area in the back, then we can sometimes re-excise and do just that. But most patients don't want to hear about another FUT scar and another excision. They want to usually switch over to FUE, which is fine. But FUT does have its merits and is still a valid surgery and a good surgery that works. But of course, we have to contend with the linear scar that it creates. But almost all men who come to my practice these days want the FUE approach. And that's really what we're doing for 99% of male hair transplant patients today. In 2022, at the age of 45, I wanted to bring up the configuration of a surgical hairline design, right? There are different ways to do it, of course. And the general pattern and shape can be more concave or it can be more convex. My personal preference for most men is to work with a more convex type of structure to the hairline. I feel that it produces the most natural type of look. And that's what my preference is. In Chris's case here, there's a little bit of a blend between concave and convex. But if you look at my gallery, we primarily build hairlines in a more convex style. And that I feel is the most natural way. But again, every surgeon has his or her own preference. So when you're looking to pick a surgeon and you're analyzing their gallery, that's something that you should pay attention to. Take a look at the hairlines that they create. Do you like how it looks? Do you like the naturality of it? Do you like the shape of it? Do you like the overall positioning? Because remember, every patient's going to have his or her own preferences. So it's not like I produce the same exact shape and positioning for every patient. That wouldn't make much sense. It's always customized to the patient. But there's still a general vibe, a general preference for the aesthetic. So make sure that you're in line with that aesthetic when you're selecting a hair transplant surgeon. But regardless of that shape, shape, whether it's more concave or convex, it's very important for men to preserve the frontotemporal corner, recreate some sense of corner recession there, because that will look much more natural as people age compared to a very curved type of appearance. I see some cases that come to me for revision work, and people have grafts that create a very kind of curved, rounded type of corner in guys, and that usually does not look the most natural. In 2023, at the age of 46, I see no change. In 2024, at the age of 47, when I saw Chris on Kelly's show, and I saw these few frames, I was seeing maybe a potential FUT scar in the occipital scalp. It was a little bit hard to tell, but with the shorter hair, I see some semblance of a potential scar. So maybe it was an FUT as his first procedure, but again, I don't know for sure, just speculating. And we can see in this image that on the left side of the hairline, the hairs kind of seem to stick up a little bit. Now, could this just be the way he was wearing his hair that day? Or maybe he wore a hat and removed it and the hair just did that? Or could it be that the angulation and directionality does not exactly match the surrounding hair? It's a bit hard for me to tell from this perspective, but again, it's something to think about when it comes to designing any hairline, that we want to preserve the original natural angles and directions for the most natural and real type of look, right? And I think overall the work that he's had done, if he's had any work, has been quite natural. But I do have to point out that the hair in that kind of sticking up configuration could be something related to the transplant as well. Remember that there is no cookie cutter hairline work, or any hair transplant work for that matter. It's all very artistic. I always say that it's like 2-part art and 1-part science. So remember, when you're picking someone to do your hair transplant, you're essentially picking your artist. You're not just picking a random clinic or a random, country to fly to. You want to pick the artist. And if you're on the same page with your surgeon about the design, and they have the ability to do good work, then you're in good hands. If you're not sure about it, then keep looking. Keep doing your research, keep doing consultations until you find someone who you can trust, who you feel has your best interests in mind, and who can properly design a hairline for you, or improve density in other parts of the scalp, or facial work, or whatever it is. And until you find that person, just keep looking is my recommendation. This is elective cosmetic work when it comes to hair restoration, and you should not settle, and you should not just go with whoever's closest to you, or whoever's cheapest, or whoever your friend told you about. Make a decision based on the things we talked about. And of course, that coupled with the pedigree of the person and their board certification, all those things matter when you're trying to choose who to see for surgery. In 2025, at the age of 48, I see no change. So in summary, I think potentially Chris may have had 2 hair transplant procedures. The first in 2008, an FUT procedure of about 1,000 to 1,400 grafts to the frontotemporal corners. And the second around 2021, this time likely an FUE procedure of about another 1,000 to maybe 1,200 grafts to the hairline for further reinforcement and recontouring. The total cost of these surgeries is estimated to be about $30,000. Do you agree with this analysis, or do you have a different take on Chris Martin's hair evolution over the years? Comment below and let me know which celebrity you'd like me to cover next. Thanks.